tabulation of Region 4 votes continues following High Court hearing and government putting systems in place to safeguard against COVID-19. It's Friday, March 13. We have lots to tell you today. Thank you for joining us. Dispute over the tabulation of the statements of poll saw the Guyana Elections Commission and the opposition PPP heading to the High Court today to seek clarification from the Chief Justice.
The Guyana Elections Commission and the PPP were back in court on Friday after a contempt of a court charge was brought by the PPP against the Commission and Region 4 Returning Officer Clement Mingo. Representatives from both sides were referred to mediation by Acting Chief Justice Roxanne George to flesh out issues surrounding the tabulation of District 4 results. After the parties could not meet a compromise, the Chief Justice sought to provide guidance and insisted that the SOPs be displayed during the tabulation process of the Region 4 results. Speaking to media operatives after the session, GECOM's Attorney Senior Counsel Neil Boston said that GECOM is in full compliance with the Chief Justice's order and accused the PPP of prolonging the process.
Mr. Lowenfield has computed the votes from the statement of poll and he has it on a spreadsheet. Now he's using this spreadsheet. He's calling numbers and then he's putting on the screen the numbers as well as the statement of poll to reflect that. But Mr. Nandalal, they want it is either Nandalal and Gunraj and Robeson Benway or no way at all. And that's not the law. So what is going on there is full compliance with the order of the Chief Justice. So the Chief Justice has given us an opportunity to go and speak about it, and then we will return because they are just prolonging this process. If we have to file affidavit, we are not going to get anywhere.
GECOM's Chairperson Justice Retired Claudette Singh reiterated that if there are discrepancies, there could be recounts.
If there's discrepancy, I would say they will be addressed at the end. And if they cannot be addressed, then why not a recount?
So you're open to a recount?
Before too, yes, box by box.
Meanwhile, after much drama at the Office of the Returning Officer, GECOM continued the counting process of the Region 4 results. The process came to a halt and resumed at the GECOM headquarters in keeping with the decision to have the remaining SOPs scanned and projected on screen for the Region 4 tabulation exercise. For InfoHub, Alexis Rodney.
Government is putting systems in place to ensure the local population is safeguarded against the transmission of the coronavirus, also known as COVID-19.
The head of state has assured that measures are being taken to prevent the risk of community spread. These include continued screening, which will take place at all ports of entry, and flagging of persons traveling from a list of high-risk countries.
Screening remains in place for those persons arriving from high-risk countries. 7 countries, Jamaica, Dominican Republic, Brazil, French Guyana, Panama, St. Vincent, and the United States of America, have been added to the list of 8. People's Republic of China, Italy, South Korea, Singapore, Japan, Thailand, Malaysia, and Iran that were previously made public.
The Ministry of Public Health has in place enhanced sensitization of key personnel at all air and sea ports. Also, the ministry has enough personnel, protective equipment in the country for our health facilities. It has also adequate stores of respiratory medicine for the next 3 months. President Granger has called on the public to refrain from panic.
I use this opportunity to appeal to the public to remain calm and to implement all the advisories relating to personal hygiene, social distancing, and overall infection prevention and control. The government of Guyana will continue to keep the public informed as we manage this public health challenge.
There has also been a robust communications campaign rolled out by the PAHO WHO in Guyana with the Ministry of Public Health to keep the population updated on the virus and its impacts. The National Emergency Operations Center will be activated to provide sector-wide support. For InfoHub, Delicia Haynes.
The Ministry of Education has advised that effective Monday, March 16, 2020, all public schools will be closed for a period of 2 weeks. The ministry said the decision will be reassessed during this period and further guidance provided. For further information, persons can contact the Ministry on telephone numbers 226-1175 or the Ministry of Public Health's hotline on 227-4986 or 624-3067. Meantime, citizens today vented their frustration following the significant hike in prices of disinfectants and other items which can be used to prevent the risk of contracting the coronavirus.
When citizens visited the local pharmacies and stores across the country to purchase the necessary disinfectants among other items, some were greeted with significant price increases, much to their dissatisfaction.
It affects a lot of people because a lot of people can't afford. They carry out up to 500, 1,000.
So I think that they should really, exploit people by overcharging them. They should sell the thing normal as usual.
The Guyana Competition and Consumers Affairs Commission has already condemned this act. Communications Officer of the Guyana Competition and Consumers Affairs Commission, Alison Parker.
The CCAC has received credible information of price gouging on items which have been recommended for use to assist in the prevention of the spread of the coronavirus. While we have no legal standing to regulate market prices, we wish to use moral suasion in our appeal to suppliers to revert to the common prices for the items they are now gouging on. We think it's morally wrong to take advantage of consumers during any national emergency, and in this case, that of a possible health crisis. We're asking suppliers to put people over excessive profits. We're asking them to desist from gouging and jacking up those prices as they have been doing over the last 2 days.
For InfoHub, I am Kellon Rover.
When the news returns, myths and facts about the novel coronavirus or COVID-19. Details after the break. Stay with us. Daddy! Welcome back. It is important to know what is true and what are half-truths about the new coronavirus or COVID-19. To help you better understand and cut through the confusion, here are some common myths about preventative measures to take.
Since the announcement of the novel coronavirus, there have been several half-truths shared on social media. To better help you understand, here are some common myths. Swallowing or gargling with bleach? False. Spraying alcohol or chlorine all over the body? False. Drinking water to flush the body of any symptoms of coronavirus? False. Taking acetic acid or consuming salt water? False. Consuming large amounts of garlic in foods or beverage? False. Wearing lightweight disposable surgical mask? False. Purchasing products that were imported from China and other countries affected by COVID-19? False. The Ministry of Public Health hotline will provide information on the coronavirus. Members of the public can call 227-4986 or 624-3067. For InfoHub, Ayana George.
Here now are some facts about the coronavirus disease or COVID-19.
Here are some facts about the coronavirus disease or COVID-19. What is COVID-19? Coronavirus or COVID-19 are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS-CoV, and severe acute respiratory syndrome, SARS-CoV. They are transmitted between animals and people. Where did it originate? COVID-19 first started in China. It eventually spread to other parts of the world, including Europe and North and South American states. Guyana recorded its first case on March 11. Of the 118,000 cases reported globally, more than 90% of cases are in just 4 countries, and 2 of those, China and the Republic of Korea, have significantly declining epidemics. About 3.5% of persons affected with COVID-19 have died, 40% are still ill, and 56.6% have recovered. Who are more at risk of contracting this disease? Persons that are higher risk of getting very sick from this illness include older adults and persons with serious chronic medical conditions. Here are some stats. Of the reported cases thus far, 14.8% were persons over 80, 70 to 79, 8%, 16 to 69, 3.6%, 50 to 59, 1.3%, 40 to 49, 0.4%, 30 to 39, 0.2%, 20 to 29, 0.2%, 10 to 19, 0.2%, and 0 to 9, 0%. People who have serious chronic medical conditions like heart disease, 10.5%, diabetes, 7.3%, lung disease, 6.3%, high blood pressure, 6%, cancer, 5.6%, no existing condition, 0.9%. The majority of the infections are mild, with 80% of infected persons with flu at home. 13.8% are severe with hospitalization, and 4.7% critical with intensive care.
Before we go, here are some precautionary measures you can take to protect yourself against COVID-19.
Here are some steps to take to prevent getting infected with the novel coronavirus. Maintain a distance of at least 1 meter from persons who are coughing or sneezing. Practice hand hygiene frequently by washing hands thoroughly with soap and water or using a hand sanitizer if hands are not visibly soiled. Cover mouth and nose with a tissue when coughing or sneezing and then discarding it. Resist the habit to touch the face. If you have a fever, cough, and difficulty breathing, seek medical attention early and share your travel history with the healthcare professional. The Ministry of Public Health has a hotline in place to provide information on the coronavirus. Members of the public can call 227-4986 or 624-3067.
That's all for today. Connect with us on all our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram. Much more news is on our website, dpi.gov.gy. Your bridge and weather reports are up next. Have a safe and enjoyable weekend. Goodbye for now.